You ever heard the word impulsive when it's used to describe kids and misbehaviors? I hear it all the time. And yes, you guessed it. I'm here to tell you why it is overused and causes a lot of confusion. So we're going to talk about the difference between being impulsive, compulsive, and just having calculated misbehaviors if you're a kid. Let's dig in. Hi out there. This is Dr. Pearce, child psychologist, coming at you with another educational video where I attempt to clear up some common misunderstandings about child behavior and mental health concerns. So let's talk about the word impulsive. You hear that word a lot when it comes to talking about kids and misbehaviors. And there's a way where this word gets described or gets used as this sort of universal descriptor for almost any kind of misbehavior. But the problem is there is a big difference between behaviors that are calculated versus behaviors that are just impulsive, and then versus another ulsive word, which sounds disgusting, but compulsive, or in other words, compulsions, but we don't say impulsions, so we're going to say impulsive behavior and compulsions. At any rate, you follow me. So let's dig in a little bit and define what impulsive means. So you'll hear this a lot, of course, connected with ADHD, rightly so. You'll also hear it a lot, perhaps connected with autism. You certainly can hear it connected with just kids in general, because obviously kids can tend to be a lot more impulsive than adults because their brains are not as well developed and they don't have the life experience. So what does it mean to be impulsive? Well, it's an extraordinarily simple term in the sense that it simply means that we tend to kind of go impulse action, and an impulse being sort of an urge or a desire, I guess. But it's a little bit more kind of primal and immediate, I would say, than the word desire. But we'll say desire or urge, impulse action, without a lot of consideration for consequences and what that could lead to in the future. So an example of this might be kiddo's in my office, and we're talking, and I'm talking to his mom, and he comes up to my desk and just grabs something off my desk because it looks cool, because let's admit it, I've got lots of cool stuff in my office. And he doesn't slow down and think, oh shoot, I should ask for permission first. The likelihood is that this is going to happen a lot of times during the evaluation during the talk I'm having with the kid and his parents, if the kid has an impulse control problem. And that's because often with these kids and people, but with these kids, if you were to ask them, hey, should you ask permission to play with something that doesn't belong to you or to see something that doesn't belong to you, they likely have the knowledge that yes, you should, but they don't have the impulse control in the moment. So now let's talk about the word compulsion. What does that mean? Compulsion basically refers to something specific that we feel like we have to do just because it relieves a kind of tension or relieves anxiety, and it usually refers to fairly specific things. So an example of this might be if I had a compulsion to constantly fix my jacket, and perhaps I had to do it in a fairly structured way. 1, 2. And then, oh my gosh, does my jacket look okay for the video? 1, 2, 1, 2. And then if my brother, who's the cameraman, said, hey, you're doing that too much, and so I'm trying to control the compulsion and trying to avoid it, oh, I can't stop at 1, 2. So there's a difference. Impulse is just kind of in the moment, on the fly, impulse action without much consideration for the consequence. Compulsion is a lot more like it's this kind of specific thing that I feel like I have to do, and I have a hard time stopping myself. So if we go back to kiddo in the office, instead of just picking up whatever thing because it's looked cool, it might be, well, I've got to touch each and every one, and if you interrupt that, oh, it's going to drive me nuts. I have to complete it, and I have to touch each one. And so you might call that an impulse, but it's different. It's more like a compulsion. And the person might not be impulsive about it all. The person sees it coming, knows it's going to come, maybe has an awareness that it's not a good idea or that it breaks some kind of social norm. But kiddo does it anyway because the compulsion says you must do this or else I'm going to give you a lot of anxiety. Now, let's just talk about calculated misbehaviors. And when I say calculated, I'm not necessarily referring to like Mr. Burns, like ree-hee-hee kind of stuff, but definitely planned misbehaviors, because those absolutely occur. An example of this might be maybe kiddo in the office scenario. So there's impulsive kid who's just, oh, cool, and doesn't slow down to think. There's compulsive kid, oh, I gotta touch each and every one of these toys, and it must be complete and I can't let it go. And then perhaps planned misbehavior kid, or functional misbehavior, but you'll see what I mean by that in a minute. Maybe I redirect the kid, like maybe he's doing something and I redirect the kid, and out of a desire for vengeance or something like that. Big scary word, but it's a very frequent motivator of misbehaviors. The kid then goes up to my stuff and is just like, whack, and just knocks one of my things off the table. And so what will happen is that very often the scenario is people say, oh, see, he's got all these impulse control problems, and they start to use that to mount an argument for why the kid has ADHD. But there's a huge difference between being impulsive, being compulsive, and having planned misbehaviors. Because you can have a kid who has a lot of planned misbehaviors, but is seldom truly impulsive, and that's certainly not ADHD. And it's true that sometimes you can have compulsive behavior, tic-like behavior, obsessive compulsive behavior, and that can be comorbid with ADHD, but they are separate. And so if you're dealing with something like an impulse or an obsessive compulsive behavior or disorder, that's an entirely separate thing that needs to be treated and understood in a separate way. And if you're dealing with something like hyperactive and impulsive type ADHD, then that, of course, is a separate thing. So what's so interesting, and one thing that endlessly fascinates me in my line of work, is that the very same or very similar misbehaviors can have radically different natures and can have radically different kind of inner lives and inner motivations. So here's another quick example. So aggression, hitting, it is another common problem that child mental health professionals deal with, but it can have radically different motivations. So it can certainly be impulsive, like, kiddo maybe with hyperactive impulsive type ADHD, just as quick to anger over little things and then kind of smacks, just impulse action. You can also have kiddo where maybe it's not so impulsive, but kiddo uses hitting as a way of escaping demands. So like, okay, Bobby, it's time to clean up the toys. No, whack. And what that's about is just, well, I'm going to kind of train you to not make demands on me because I don't like demands. They make me anxious or upset. So don't make demands on me, doc. I suppose you theoretically could have like compulsive hitting, but it usually doesn't express itself in that way. Sometimes too, you can have hitting that's actually attention seeking. I don't like the term attention seeking. It gets used as this really nebulous way of dismissing kids' problems, but it's true that some people, including some kids, are very highly socially motivated, which is to say they love interaction with other people, they love attention with other people or from other people, and there's nothing wrong with that at all. But I've seen situations where when attention is not giving big enough and quick enough, usually from like a parent, then you'll have a kiddo, often a little kiddo, who will then up the ante for the parent's attention by hitting. And so you have to respond to those behaviors in a very different way, because if you respond to an attention-seeking hitting with a lot of like, what, you can't hit me, you can't do that, which, and I'm gonna give you a timeout or something, which is legitimate in many situations, you actually run the risk of just reinforcing the behavior, because the kid goes, okay, well, what I'm really interested in is attention. So if other types of bids for your attention don't work, if I hit you, I at least get something from you, right? Whereas a kid who's hitting to escape demands, you probably wouldn't want to ignore that kid and think of it as being attention motivated, because the kid is perfectly happy with you ignoring him. That's the whole point of the hitting, is to escape a demand and get you to just kind of take a hike so that you don't place a demand on the kid. So at any rate, thank you for listening. The difference between impulse, compulsion, and just, sort of functional or planned misbehaviors. is important to understand, if you ask me. So at any rate, thank you so much. The channel just recently surpassed 200 subscribers, which means a lot to me. So thank you to each and every one of you. If you have not yet subscribed, please consider doing so. Oh, I wasn't trying to give myself a thumbs down. Please consider doing so down there and give me a thumbs up if you found the video to be of use. Otherwise, we will see you in the next one. Bye-bye.